is all about the yellow fever outbreak in Edo State. You might have heard about it on the news. You might have heard about the figures, heard about the numbers of persons affected or infected. And of course, you might have done some research about the signs and symptoms and how one can really differentiate it from Lassa fever. With me here in the studio, I have a medical practitioner, a consultant, a physician and public health, if I'm not mistaken, right? Please join me. Welcome, Dr. Francis Era. Welcome to the show, Doc.
Morning, sir.
I appreciate you coming.
Thank you.
Here we are again, another health disturbance, so to speak, and is the yellow fever outbreak in Edo State. We've had the Commissioner for Health talked about it, and you are on the field. You've seen firsthand of cases of patients with yellow fever, and according to you, you've lost some patients due to that ailment. Could you please throw more light on what is really happening in the health sector as it relates to the yellow fever outbreak?
Yeah. Before I respond to your question, I think the best thing is to, what made me come here is because of the rumors or propagandas that are being disseminated in the social media. I read a post of somebody who is talking about people should not gather, people should avoid the public places, they should avoid markets and all that. And I want to say here that that is very, very, a yellow fever is very different from other hemorrhagic fever. And please, there should be no panic. There is nothing like handshake, avoid handshake, don't do that, don't hug. That is not correct. So there is actually an outbreak of yellow fever in Edo State. In fact, in Nigeria and in many states have been affected. In Edo State, we have an outbreak of yellow fever. Some of the patients present with what we call hemorrhagic symptoms. They bleed from the nose, from the mouth, from the anus, from the ear. And sometimes when you put up a needle, a syringe, or you put up a cannula, they tend to bleed from those puncture sites. And those are features that suggest what we call hemorrhagic fever. And many people thought they were Lassa fever. And they end up coming up, getting to the reference center in Edo State, which is Irua Specialist Teaching Hospital. But the Lassa fever test that was carried out among most of them that came, they came out negative. So that also raised some suspicion. What else could this be? And there was this rumor of a strange disease in Edo State and all that. But a further test that was carried out shows that many of them became positive to yellow fever. So there is actually a confirmed outbreak of yellow fever in Nigeria, and particularly in Edo State.
All right, now you talked about outbreak. We're having this confusion about numbers. Some said it's 20, some said 9, others saying it's 2. From what you've seen in the field, after all, you work there at Irua Specialist Hospital, from a first-hand information, like how many now? Not to cause panic, but just to make it clear.
Well, I think the Commissioner of Health yesterday announced that 2 have been confirmed.
Yeah.
Why he said that is this. There's a reference center where yellow fever is confirmed for Nigeria, is Dakar. And the samples that have been taken to Dakar came out, 2 came out positive for Edo patients, as at the time those samples were taken there. But after that time, we've received other cases, other patients, and some samples have also been taken. And what I can say here is that those samples need to be taken to Dakar for confirmation. But we have been able to do other tests and shows that, for example, in our center, the 12 patients that came and about 11 died, and we were suspecting yellow fever, and the blood sample was taken for PCR to confirm Lassa fever. It came out negative. So those samples was further sent for investigations, and we discovered out of 12, 9 were positive to yellow fever. So, but why that, what we, like what I'm trying to say, those samples need to be taken to Dakar and confirmed before we can come out authoritative to say it's more than 2. But what we are seeing on the field is that they're obviously more than 2, and they are coming because many centers refer them to Area Specialty Hospital, thinking that they are Lassa fever because they present like Lassa fever. They bleed from all sorts of places, and when they bring them to us, we also think that they are Lassa fever. We start, some of them we proactively give, because what we do, if you suspect Lassa fever, before the diagnosis come, especially when they come with the presentation that you know that if you wait for, because it takes about a minimum of 8 hours for the result to come out. So if you suspect that it's Lassa and you have a very strong suspicion, we end up giving the drug called ribavirin. Some of them were inadvertently given ribavirin, thinking that they are yellow fever, Lassa fever. But the tests that were further carried out shows that they are yellow fever.
All right, so what are the signs? So we've talked about hemorrhage, bleeding. Are there other signs?
Where I want to quickly say that symptoms are the one the patient present with, they complain about. Then the signs are the one the doctor are able to elicit. For example, if a patient comes and says, my eyes are yellow, maybe he looks at the mirror and sees that his eye is yellow, then you yourself will look yourself and see that the eye is actually yellow, and you can say there's jaundice. So the one the doctor elicits is what we call sign, while the one the patient complain about is what we call symptoms. So let me start with the symptoms. I will classify the symptoms in 3 categories. There is what we call constitutional symptoms, where the patient presents with symptoms that look like every other thing, look like malaria, look like typhoid fever, it looks like last other hemorrhagic fevers, it looks like anything that we call it constitutional symptoms, like headache. They come with headache, they come with fever, they come with abdominal pains, they come with muscle pains, some of them end up vomiting and all that, joint pains. So those are what we call constitutional symptoms. For yellow fever, the classical way yellow fever presents is that for the first 3 days, the patient has those constitutional symptoms of headache, body pains, chest pain, abdominal pains, vomiting. So after 3 to 4 days, the symptoms may wear off, and the symptom can wear off for 24 hours. For many people, those that will not come down or go to have other symptoms, they may just recover. But for those that will end up in stage 2, they will have other symptoms that we end up having what we call the hemorrhagic phase, where they start bleeding from everywhere. They bleed from the eyes, they bleed from the nose, they bleed from the mouth, the anus.
That's the advanced stage.
That is, for me, I would call that an intermediate stage, but some books will tell you that it's an advanced stage. But it's like if there's a multi-organ affectation. The organs are already affected, the liver is affected, the kidneys are, some of them start having kidney problems and all that. So in that phase, you will see many of them having the features, that yellowness of the eyes. Some of them will start bleeding from everywhere. Some of them start vomiting repeatedly. So that in that case, some of them can have renal problems, severe abdominal pains and vomiting. All the initial symptoms that are aware of can return back. Then some may eventually progress to a stage that, from what we discover, they end up dying once they get to that stage. They start having CNS manifestations.
What about CNS manifestation?
That is, central nervous system. That's the brain get involved. So once the brain gets involved, that's a multi-organ problem. Once the brain gets involved, some of them start having altered sensorium. They are not, seem to be aware of where they are. They start having seizures. Then some of them start, in the course of having seizures, some of them end up with other CNS manifestations that eventually can lead to sudden death. So from the first constitutional symptoms to that symptoms where they start having affectation of the organs, the liver, the kidney, then eventually it gets to the brain, having altered sensorium. Some of them start talking irrationally. You would think they are mad. They start talking out of sense. Some of them begin to convulse, and then eventually they succumb. They go into unconsciousness.
So that shutdown of the system?
Yeah, the system shuts down.
Quite scary. All right, now, what are the vectors of yellow fever?
Well, the particular vector that is identified to cause yellow fever is what we call the Aedes aegypti. It's a mosquito.
Aedes aegypti.
It's a type of mosquito. Yes, yeah. It's a mosquito. And there are 3 phases of the transmission cycle that is transmitted by this Aedes aegypti. There's a jungle type where you have a species that we call Hemogogus, and there's another aegypti. They live in the bush. They are vectors that live in the bush, and in fact in the forest. They end up sucking blood from monkeys. The reservoir of yellow fever is actually monkey.
From the monkeys?
Yes. Wow. So the monkeys may not have the symptoms, but the vector end up feed on the monkeys and pick the virus from them. The yellow fever belongs to it's an arbovirus with its genus of flavivirus. So the yellow fever is picked up by this Aedes aegypti and Hemogogus in the jungle. And people that walk around the bush, maybe the hunters, or people that travel along the bush, or people, for one reason or the other, you come across them in the bush, the mosquito now bites them and transmit the yellow fever to them. So those ones can come down with yellow fever. That is what we call the jungle type. But sometimes these people that are in the bush, they have a home, they come to the house. When they come to the house, there is a group of mosquitoes that live around the urban areas. So this second phase we call the urban yellow fever. The vectors in the homes, which is usually the Aedes aegypti, end up biting or feeding on the people that are already infected, and they pick the yellow fever from them as well. So once they pick the yellow fever from those infected persons, they end up biting other persons and then transmit it to them. But people that usually have this infection are those that don't have the immunity, because once you have the infection and you have enough antibodies to fight, like what antibodies are like soldiers in the body, they end up fighting them if those people have initially been immunized. But for one reason or the other, maybe they didn't get immunized and there is no herd immunity within that community, those people get infected. So that is the urban type. The other type is the mixed type, where you have both the urban and the jungle type. And that is one that normally cause outbreak in Africa. The ones that normally cause outbreak in Africa, because this yellow fever tend to be endemic in Africa, in Central and South America. But the ones that usually cause outbreak in Africa is the mixed type, where you have both the jungle and the urban yellow fever.
Wow. What a reaction, what a chain. Now, these are the signs, symptoms, of course, the vector. If you talk about vector, talking about the agent that transmits or carries a disease from one person to the other. You talked about the forest, talked about the urban, talked about the jungle. Now, let's talk about preventive or corrective measures. How can one really, fortify oneself to be infected by this yellow fever ailment or disease, or how can one really prevent it?
Before I talk about corrective, let me talk about the prevention.
All right.
The usual mode of prevention is actually 2 major means of prevention. One is immunization.
All right.
Once you are immunized, you are protected for life.
For life?
You are protected for life. So it's important that you get immunized. Once you take the yellow fever vaccine, you have a protection. And that protection is such that you have an antibody that is ready 24 hours to fight any of the virus that enter the body. So that means you have a lifelong immunity. Then the other means of prevention is what we call the vector control. So, but for why a yellow fever is a bit difficult is that the mosquito, the vector tend to bite during the day.
During the day?
During the day, so that's why the use of insecticide-treated nets may not be very, very effective, because it tends to bite during the day. So most of the time, you sleep under the insecticide net at night. And so, but that doesn't mean that you will not. You will still end up using. Make sure you try and avoid mosquito bite by all means.
By all means.
Yes. Sometimes if you can use a repellent or use wear clothes that tend to cover major parts of your body, especially when you are going to endemic zone or you are entering the forest, or you have a reason to go to a place where you know that Lassa fever is endemic in this area. So you try to wear clothes that will cover most of your body.
All right, Doc. We will keep monitoring. Of course, I have your contact now. If there are issues on this kind of health issues, I'll just contact you to come through more light on it. You talk about preventive and curative, preventive immunization. Once you get immunized, you are immune for life. And of course, for the preventive measures, you have to deseat your drains, cut the grasses. If you're going to area that are prone to yellow fever attack, you have to cover your body because they bite during the day. Interesting. Or use repellent if you want to go hunt. Yes. So these for hunters, right? That goes out there to hunt for games. All right, you've heard them. This is not to cause panic. It's just to let you know how to really comport yourself.
Can I say one more?
All right. I'll come back to you. How to comport yourself in case you're going to this region. You have to fortify yourself. If not been immunized, you have to go to hospitals, right, to get immunized. Once you're immunized for a life. Okay. Now, to draw the curtains on this discourse, what advice do you have for people out there terrified of the outbreak of this yellow fever?
What I will advise you is please go to any health facility to get immunized if you have not taken the yellow fever vaccine before. And if you have taken before, I think you don't need to worry. You don't need to bother yourself.
What if those I don't know what I've taken or not?
That is for those that are
not so sure.
If you are not sure, a second dose will not harm you.
Okay.
I will advise that you go back and take another one if you are not sure you have taken before. And for mostly health workers that work in the hospitals,
yes,
because most of these patients come to you and they may be beating and the vector may be around or for one reason or the other and they end up biting. I will advise that if you are not sure at all that you have taken the vaccine, please go and take again.
The second shot will not harm you.
It will not harm you.
Okay.
But if you are sure you have taken before, you don't need to panic.
All right.
And then what I wanted to say was this, that please, you don't have any reason to panic. It's not, yellow fever is not like the Ebola that we know or Lassa fever that we know. It's not known to be transmitted from handshakes or from sweats or from bloods or whatever. But what we normally do in the hospital is that we ask you to observe what we call standard precaution. As you see one patient, don't even assume that this patient does not have problem, this one has. No. Observe the same precaution as you see one patient, the same you apply for all patients. So I will ask you, I will advise you still maintain that. But for people in the homes, in the houses, please don't have any reason to worry when you see such persons. What I will advise you, take them to the hospital. When they get to the hospital and they are able to diagnose, find out the cause, they will just, the treatment, you know, talk about curative. So the main treatment, there's no cure. The main treatment is to treat what we call symptomatically. Those that are vomiting, replace the fluid and all that.
All right. Thank you so much, Dr. Francis Era. I appreciate your wonderful analysis. You see, it's not to cause panic. All you need to do is go and get immunized, okay? If you are not sure you've been immunized, the second dose or third dose will not harm you. Just go make sure. Be sure. And of course, he mentioned some preventive measures. Just follow those procedures. There's no need for you to panic. No need for you to shut yourself off the society because of yellow fever. Go about your normal duties as long as you fulfill obey those rules and regulations governing health tips. You see, I'm giving you a handshake right now. Though you work at the hospital, I'm not scared. Doc, once more. Thank you. The pleasure is mine. Thank you so much for coming. Well, go get yourself immunized.